Is it just a sign of getting older, or is it something more? Many of us have this worry about our aging parents, but here's a shocking fact. The average delay between first dementia symptoms and a diagnosis is over 3 years. Why? Because early signs are too often dismissed as just normal aging, fueled by fear and stigma. This long delay means missing a window for planning, support, and effective care management. In the next few minutes, we'll break down the specific differences so you can spot the signs that truly matter. So what is the single biggest dividing line? It's whether cognitive changes consistently disrupt daily life. With normal aging, thinking might slow down, but you can still manage your life and daily routines independently. Dementia isn't just slowing down, it's a decline in function that worsens over time and interferes with daily tasks. Let's be clear, some memory loss is common. Almost 40% of people over 65 experience age-related memory changes. But the type of memory loss is what separates normal from concerning. It's about how you forget. In normal aging, a memory is stored correctly. The problem is just retrieving it, like a misplaced file. With dementia, the brain's ability to store new information can be damaged. The memory was never filed away properly. Aging is forgetting a neighbor's name, but a clue helps you recall. Dementia is not recognizing them at all. Normal aging, losing your keys and retracing your steps. Dementia sign, finding your keys in the fridge. Normal aging, a word on the tip of your tongue. Dementia sign, calling things by the wrong name entirely. Normal aging, needing help with a new gadget. Dementia sign, trouble following a recipe used for years. These examples show a clear pattern. But what about the symptoms that have nothing to do with memory? A common, subtle sign is apathy. This isn't sadness, but a loss of interest in hobbies and social events. Normal aging might make someone more set in their ways, but dementia can fundamentally alter a personality. They might become uncharacteristically suspicious or fearful, or withdraw from social situations they find overwhelming. Beyond behavior, dementia can change how a person perceives the world. Have you seen issues with concepts or vision? This includes struggling with numbers. Managing a checkbook becomes impossible, which is different from a math error. For some, it causes problems with visual information, like judging distance or contrast, making driving dangerous. It's also good to know that not all serious memory problems are dementia. Some treatable conditions cause similar signs. Let's return to that 3.5-year diagnosis delay. Now we can see the reason. We are often looking only for memory loss, when in fact, the earliest signs might be apathy or personality changes, dismissed as just being moody. The real question isn't, is mom forgetting? But, are these changes disrupting her ability to live safely? Recognizing this pattern is the first step. So, what is the next logical action to take? To put it simply, normal aging is the brain slowing down. Dementia is the brain breaking down. Pay attention to memory loss that disrupts life, new challenges in problem solving, and major shifts in mood. If concerned, a doctor might use a screening tool like the mini-cog test, which involves recalling words and drawing a clock. Differentiating these signs is not an academic exercise. It is absolutely necessary for an early diagnosis and proper care. Remember the fear that contributes to the diagnosis delay? Knowing the real signs gives you the confidence to act. If you are worried about yourself or someone you love, the most powerful step is to talk with a doctor. Don't wait. Understanding is the first step to action. Share this video to help others know the difference.